We're going to reconvene. Thanks, everybody, for coming back after that short lunch break. We hope you observed what your tax bill was if you paid for your lunch, or especially your beverage. I'm Biasi. I'm with the Trust for America's Health, and I'm so pleased to kick off this panel. Like many of my predecessors on the panels, I'm not a tax expert, so we all have to say that disclaimer. But I have to say that most what I've thought about in terms of tax policy as it relates to population health, I've really learned from Stacy Becker of ReThink Health. So I'm so pleased to be able to introduce this panel where she's going to talk more in depth about the ideas she's been exploring. There's really nobody who's been thinking about this more than Stacy. So I know you're going to learn from her as I have. And I think people know what ReThink is, but I'm impressed that one of the goals of ReThink Health is really to get that big picture idea out there. And this is one of those big picture ideas, okay, all towards creating a health system that really values the health of individuals and communities. But what impresses me about ReThink is really that big picture idea. A lot of us don't take those things on, and especially things like tax policy that all of us feel a little funny about because we really don't know that much about it. So I appreciate that Stacy has taken it on. I've learned a lot from her, and in addition to Stacy Becker, who's the Vice President of Programs at ReThink Health, and you see her bio in your packet and your materials, but you should note really that Stacy has a lot of experience when it comes to anything related to numbers and public service, be that budgeting, sustainability planning, long-term financing. She really has a great range of expertise and experience that she's bringing to this thinking that she's doing around tax policy, and particularly the idea of a tax credit. Stacy will be joined by her two colleagues at ReThink. Nina Burke and Amanda McIntosh are going to talk specifically about some legislative specifications that they've developed for this very concrete idea of a tax credit. So that's really exciting to get the big idea, the big picture out there, but also to put some actual specifications on the table so we can begin to have a really robust debate. So please join me in welcoming the ReThink team.
Thank you, Anne. Like Pete, I think I'm going to walk around and see if I can do this two-fisted. There are a couple people who've been thinking about this as much as me, and this would be this amazing team we've put together that includes Nina and Amanda, who you'll hear from, but also Maggie Cook in the back, Ella Auchincloss, and Catherine Wright. We've really put together a big team to bring this to you today. So this morning you heard this great panel on taxes and how taxes could be used for population health. We're going to shift gears a little bit and talk about tax credits. First big difference, as I think Bobby mentioned, is taxes raise how much you pay to the government. Tax credits lower how much you pay to the government. And it's like, well, how can people pay less? And we use that to fund something, and that's what we're going to explore today. We're going to do it through the story and the eyes of Ourlandia. After this presentation, you'll all be designing a tax policy for the fictional Ourlandia. And we thought it might be interesting to tell the story of tax credits through Ourlandia's eyes. After we do that, we know that you could still be some head scratching about how would this actually work in practice. So ReThink has taken the liberty of designing two Ourlandia prototype legislation that would use a tax credit, and they will present those. And then I'll come back and do a little summary that will kind of compare what we've heard today. How do taxes differ from tax policy as we think about population health? So here we go. The story of Ourlandia and how it explored a tax credit to keep its people from suffering. So unlike a novel, the story of Ourlandia, we don't need any, there's no spoiler alert here, we don't have no suspense. So I'm going to give you the cliff notes up front. Number one, we will find, you've heard already this morning, that tax credits are used extensively but not very much for population health. There we go. Number 2, there's a basket of population health interventions that really offer very impressive opportunities to improve health and lower cost, but we don't really have a functioning market for them. I thought the cap and trade was very interesting, how you start to think about markets for some of these things. Tax credits may offer a way of developing this market further. Some tax credits are effective, others are not, and you heard a lot about that this morning, that we really need to think about design and unintended consequences. And we also heard about this morning, that there's an opportunity to redeploy funds to give taxpayers, not only to help population health, but to improve the returns for taxpayers. When taxpayers are investing, if you think about it, them as investors in this tax credit, that they too can, their money can be used more wisely as well. So here we go. Orlandia, the story of Orlandia. And the governor of Orlandia said, wow, we have a problem. Our people are really suffering, and let's get together and talk about that. So he called people across the land, and they convened, and he said, you know, it's my observation that people are suffering. What are you guys seeing? And someone stood up. She worked at a hospital, and she said, you know, too many of our babies are born underweight, and too many are dying. And by the way, even though this is Orlandia, all the data you will see are actual real data. And we have a very unusual problem that it's much higher than other states. And they're really, I don't know why this needs to be. And someone else stood up, someone in schools, and said, too many of our children are being poisoned by lead. And we know what lead poisoning does to children. We talk about education and the importance of that, but their brains are damaged before they even get into school. And they go on and they can't earn as much. And some of them even, we know there's higher crime rates, much less the health impacts. And a mother stood up and she said, you know, I lost my son to opioids. And I know I'm not the only one. And surely all of this increase in opioid deaths, surely there's something we can be doing about that. And the room went on and on with these sorts of stories about how people were really not doing well. And then someone stood up and said, you know what, I'm a population health expert. And the really interesting thing here is we know that health isn't created just in the doctor's office. It has to do with environmental and social and economic impacts and conditions. But we know there are effective solutions to these things with evidence-based. For example, there is a prenatal care intervention for teens, and it costs $513, and it saves taxpayers double that, saves participants, it reduces infant mortality. And this person went on and said, and lead poisoning. We know very conservatively that every dollar invested in lead poisoning returns at least $17 in benefits. And there is an opioid intervention program that saves double in healthcare costs than the cost on average of the program. And it improves lifespan. We know these things. These are meta-analysis, high evidence-based. And these are just the tip of the iceberg that's out there. So now the room is like, whoa, wait a minute. We're suffering in these ways, and you're telling me we know what to do about them? So why aren't we investing more in these solutions? So someone said, well, maybe we don't really care. And, oh, no, we care. So, okay, let's get rid of that idea. Maybe we weren't aware of the effectiveness of these interventions. We weren't aware that some of these were available. Well, they said, well, we know now, so can't use that for an excuse. So maybe the problem is that, yeah, you talked about all those benefits, but they don't go just to one person. They're spread out all across in different sectors and different people, and so that no one person wants to pay, or no one organization. People kind of scratch their head. That made some sense. Maybe they didn't quite get it, but that was plausible. Maybe the payback period is too long. These kids, for example, with lead poisoning, it's years and years before they're going to be in the workforce. So maybe we just don't want to wait that long. And maybe we just don't have enough funding. Someone in the room said, you know, I saw this study by ReThink Health, and it looked at multi-sector partnerships and that work in the area of population health, and almost all of them rely on grants. And they have more than that, very few ideas or prospects for moving beyond that. So the room is considering this. And then some little kind of nerdy person in the back of the room said, well, I have an idea. Could we use tax credits to create a pool of funds to help with interventions such as these? Well, now the room really erupted. They were like, wait a minute, tax breaks. Tax breaks are just boondoggles, aren't they? They're just like favors for the rich and famous. What are you talking about, tax credits for population health? So then the mother who lost her son to opioids stood up and she said, you know, we said we cared. We said we want to do something about this. Surely, whether it's tax credits or taxes or some other funding source, none of this is particularly easy. But if we care, isn't it important to try? Isn't it important to at least explore what might be possible? And so the room kind of agreed, yes, you're right. And the governor said, all right, does anyone take that on? It was your idea, the tax credits. Would you be willing to take it on? And the person said yes, and the governor said, okay, we'll convene in 2 weeks, and you come back and you find out what you know. And the person was like, 2 weeks? And he goes, okay, 3. All right, so you got 3 weeks, and we're going to reconvene. So they reconvened in 3 weeks. And this person's presentation went like this. I'm going to share a little bit with you about the tax credit landscape. So first of all, what's a tax credit? We heard a little bit about this morning. So it's one form of something known as tax expenditures. And tax expenditures are nothing more than a fancy word for a tax break. That's what it is. So there are tax deductions where you get to reduce certain expenses from your taxable income, like the home mortgage interest deduction or charitable deductions. There are tax exclusions, where you get to exclude certain types of income from your taxable income, such as Social Security income. And then there are tax credits. This is $1, as Pete was saying this morning, $1 for dollar reduction on your tax liability. Therefore, the value of it is more certain. It's that dollar amount. There is a delay on this. All right, so we heard some numbers this morning. Tax expenditures are heavily used. At the federal level, there are more than 200 types of tax breaks claimed on 169 million tax returns, more than 1.5 million in total. Take a look at that. Trillion. Compared to defense spending, compared to Medicare, compared to Social Security. Huge. This is a huge piece of our national fiscal fabric. Now, at the state level, we also have lots of tax expenditures, and virtually every state puts out reports that look something like this. The interesting thing about transparency is this is probably about the most, not in the process, very detailed information about every tax expenditure, what it's worth, what is the law behind it. And if you're nerdy like our little Orlandia person, it can be kind of interesting reading. So for Orlandia, we looked at all these different states, and we found out that despite $1.5 trillion at the federal level and all these different states, that there are actually few tax credits for population health or the social determinants of health. This morning, we talked about some important federal ones, the Earned Income Tax Credit and Low-Income Housing. We looked through every state tax expenditure book, and we found a few. Massachusetts has a tax credit for lead abatement. New Hampshire for opioid program coordination. Arizona has a tax credit for anti-poverty organizations, and Colorado for early childhood education. But this is about it. This is about it. So there's really nothing out there that enables the funding of local portfolios for health and well-being. So there are some that, as you see, are geared toward very specific programs. But health is this broad array of social determinants, right? So it requires more usually than a single sort of intervention. And also this idea of local, because the needs vary from community to community. So how could you do this? And there is nothing really that allows people to pool funds from a tax credit for health and well-being. So how do tax credits work? They kind of work like a giant rebate program. You buy a solar panel, you get a 30% tax credit. Let's say you spend $10,000 on solar panels. Then you ask the federal government when you file your taxes for that $3,000 back. And that's kind of how it works on your taxes. The idea is that it subsidizes private investment. I'm a private person buying my solar panels, and it's reducing the cost to me of that purchase. By doing that, it increases the return on investment to that person making that purchase, because the benefits are the same of the purchase, but you lowered my cost. So the returns look much more favorable. And as we talked about cap and trade, we're stimulating supply and demand for these types of goods. So we're going to give you a little example here of one such intervention that could be used in a portfolio, and this is this opioid program. So the costs of this program are $356 per person on average, and the benefits are split here. We've got about the same amount going to taxpayers, and they get that amount back in healthcare savings, and health insurers get about the same amount back. Now, if you're either of them, you're looking and going, you know, I'm going to invest $356, I'm going to get the same amount back, and it takes 2 years to get it back. That's about a wash. I think I can make some better investments. And like we talked about this morning with, I'm waiting, externalities, there's positive ones. What's happening with this program is it creates all these other financial and social benefits, including longer lives. And so because nobody wants to invest, all of that gets left out on the table. That is all waiting out in society for someone to invest. Now here's what happens when you do a tax credit. You're splitting the cost. The taxpayers are saying, I'll split the cost, in this case with a 50% tax credit, I'll split the cost with you, right? So now they're each paying $178. And now those returns look really good. I'm doubling my money in 2 years. And now, yes, I want to invest. And now by doing that, all of these other fabulous benefits accrue to our communities. So as we have been hearing throughout the day, design is really paramount. And it's clear as we look through a variety of tax credits in our short 3 weeks that some tax credit programs work and achieve their objectives and others do not. We have the low-income housing tax credit as a federal tax credit that's effective. It has produced a great deal of affordable housing. It has some unintended consequences. We'll get to that in a minute as we started talking about this morning. On the opposite end are business incentives at the state level that really have been shown not to be very effective at all. So what this means is there's some key design questions. What is it we need to think about if we want to do a tax credit for population health? The first thing we want to ask ourselves is there a taxpayer? Let's just pause there for a minute and think about that. Like that's a kind of like Homer Simpson, like, ugh, what do you mean is there, that seems like a big duh. But if you think about a tax credit, a lot of population health interventions are provided either in the public sector or nonprofits. A tax credit only works if someone's paying taxes, that it doesn't have any value if you have no tax liability. So you really need to look to the private sector and folks who pay taxes so that the tax credit it's reducing the amount of tax they owe. So this can be a little tricky in thinking about this. Likewise, what is the market? You're tapping into a specific market, like cap and trade. There's a specific kind of supply and demand for something that has to be there in order for a tax credit to work. Because remember, it's a subsidy, it's an incentive. So if nobody cares about the market for only buying left shoes, you could have a tax credit till kingdom come and nobody's still gonna buy just the left shoe. How big should the subsidy be? You heard a little bit about that this morning. We talk about this in terms of price sensitive. Should it be 20% tax credit, meaning I get 20 cents back on the dollar? I get 20-cent rebate for every dollar. Should it be 50? Should it be 80? This can be tricky. There is research. Amanda's going to talk about that a little bit with her legislative design. But it's very important, since this is an incentive, to this is one of the things you kind of get right, because you don't want to pay people for things they're already doing, and you don't want to set it too low so that the incentive has no impact. Spent a lot of time talking about this morning, the distributional impacts, and this is especially where unintended consequences can come into play. And as folks this morning talked about, there are the distributional impacts of who gets to claim the credit. Do we care about that? And then how are the funds from the credit used? How does that distribution of funds play out? What does it take to administer? Some tax credits are very straightforward, pretty, like the solar tax credit. I buy my solar panel, I put it on my, write it off on my taxes. Excuse me. Others are very, very complicated. We talked this morning about the low-income housing tax credit. The reason why it's so expensive is it literally creates a tradable asset. People can trade that credit. It's a financial asset. So it created this whole industry and whole market, and it needs lawyers, and it needs financiers to make this work. So a lot of that, as much as Maggie was saying, 25% more, comes right off the top, and it's very, very, if some of you have worked in the area of affordable housing, you know it's a whole industry in and of itself. And then how do we know it's achieving its aims? This one's really important and is one of the critics, a lot of the critics of tax credits will say they're not very accountable. And yet you can build accountability into a tax credit. So I'll leave you with one more thing, which is the opportunity potentially of redeploying existing funds. We heard about that this morning. And I want to give you one very specific opportunity. And that has to do with the $45 billion that is spent annually in state and local business incentives. These are enterprise zones, empowerment zones, film credits are now a big popular credit. And there have been numerous studies that have looked at these business incentives to determine whether or not they're actually achieving their objective. And a very recent study said, nope, they don't correlate with unemployment or income or future economic growth. The Federal Reserve Bank here in San Francisco said that enterprise zones haven't been effective at creating jobs. It's hard to make the case that they furthered distributional goals of reducing poverty in the zones. And they went on to say it's really the real estate folks who are making the money off of the tax credit. There was a study in New Jersey that said for every dollar spent on the credit, taxpayers got back 8 cents. So there's a kind of growing consensus around the way we do these business incentives that really they are not achieving their intended purpose. So the key conclusions that I want to offer for you Orlandians is that tax credit programs are feasible. We have to really pay careful attention to design. But there is an opportunity to potentially to redeploy funds for greater impact. And with that, I will leave Orlandia and we will reconvene in about 20 minutes, I think, to do our design, right? We'll be back to Orlandia. I know that with that overview, it can still be hard to imagine, well, what exactly could that look like? How exactly could that be done? So I have two fabulous people here. They actually came up with how this could be done. We've got two possible examples for you. These are, I want to stress, prototypes. They would have to be, as we learned this morning, it's about the politics and negotiating, lots of design stuff that would have to be worked out at the state level. We really think, as many people said, the opportunity here is for prototyping at the state level. These adventurous women have developed their tax credit scheme, and Nina is first going to come up and share hers with you.
All right. Well, thank you, Stacy, for stressing that these are indeed prototypes. Oh, do you still have the clicker? Oh, yes, sorry. That's okay. Thank you. All right. So I am going to be talking about the healthier workforce tax credit, although I do like the happy, healthy tax that was mentioned earlier. So maybe this will be the happy, healthier workforce tax credit. And this is a tax credit for self-insured employers to broaden their investments in health. Yep. I was hoping that I preloaded the slide to avoid this. So as Stacy mentioned, and as the other presenters mentioned this morning, design is really critical to the success of a tax credit. So I'm going to walk through this prototype based on the 6 key design questions that Stacy just talked about in her presentation. So just a quick brief overview of what this tax credit would do. So it would provide a 50% tax credit to self-insured employers who invest in a certified curated portfolio of interventions for their employees and their families who they cover. So the first question is there a taxpayer? And there is, and the self-insured employers pay taxes. There is indeed a market that we could potentially tap into for this tax credit. There's currently about $6 billion currently floating around in the employee wellness program market that could be tapped. The size of the tax incentive, as I mentioned, it's 50%, but what the employer would actually receive is dependent on the interventions that they invest in, for how many employees, for how long, and all of those factors. The distributional impacts would be limited to those who are employed by these self-insured employers and their families. So we are aware that this does not touch the whole population. The administration of this tax credit could actually be fairly simple. We will pass out folders with the legislation in it so you can see what we've actually created for the admin of this program, but it should not be too complicated or burdensome. And finally, the 6th principle, which is one of my personal favorites, accountability. So how do we make sure that this tax credit stays on the books and is meeting its aims and meeting the needs of our Irelandians, the taxpayers, and the employers? So in order to hold people accountable, we would have state-certified interventions with a demonstrated return on investment to make sure that these employers are claiming a tax credit for interventions that actually work. We would put a cap on the annual state budget for this tax credit, and we would put a cap on the amount that employers could claim on their annual tax return based on the number of employees that they have and that they cover. And finally, there would be annual reporting requirements from the employers and from the State Department of Health to actually look at all of this data to make sure that things are going as planned And in 5 years, the tax credit would actually be set to sunset in order to make sure that it's doing what it's supposed to do. And if after 5 years it's determined that this tax credit is not meeting the aims, then it could potentially be revised. There's a delay, but on the next slide I will talk about why could this idea actually work. Okay, great. This side is preloaded. So this idea could work because there are an estimated 100 million Americans who are covered by self-funded employer plans. And these employers who take on the risk of providing insurance to their employees have a business incentive for keeping their costs down because this directly affects their cash flow. And this tax credit would increase the return on investment, as Stacy mentioned, because the benefits remain the same from whatever programs they invest in, but the tax credit directly reduces the upfront costs. And we have already discussed that there is no perfect tax credit, and there are potential challenges that we want to address upfront, and that is that employers likely prefer short-term investments that are predictable and that they really can budget for, and if they have a short-term budgeting process. And as I mentioned, this will not reach the full population, only those employees who are covered and their families. And even though we would put together a state-curated portfolio, the employers would still have the agency to select what interventions to provide their employees, which may or may not align with what the community actually needs. So in a perfect world of perfect tax credits, despite the potential challenges on the previous slide, we think that there is a serious opportunity for success in a tax credit scheme such as this one. And we would hope for success in terms of lower healthcare costs for employer and the employee, reduced absenteeism and increased productivity, prevention of chronic disease, an overall healthier workforce in a region and therefore increased regional economic productivity. Reduced social expenditures to the state and higher tax revenue because healthier people are working more and working longer, and the golden ticket of all of this being a return on investment for all parties involved. And now I will turn it over to Amanda.
Hi, I'm Amanda McIntosh, and I'm going to give an overview to another mock legislation that our team drafted that is looking specifically at using charitable tax credits to fund wellness funds that would be operating as part of accountable communities for health. And so this one is named the People's Choice Health Investment Credit. Okay, and I'm going to go through this similar to how Nina did by going through the criteria that Stacy, the design criteria that Stacy listed previously. Let's reload these. Okay, so what taxpayers would be eligible for the charitable tax credit? So we would offer this to individuals and corporations. In a lot of the research that I looked at, many state charitable tax credits were only focused on either corporations or individuals, but we don't want to isolate any donors, and we want to be as inclusive as we can in this process. And so we want to open it up to the widest catchment possible too, to increase the amount of funds. And we do see a huge market for this. About $354 billion in charitable donations were generated in 2014. And we have research that shows that this is even growing. There's a market for this that I'll speak about later in the slides. So the size of the tax incentive matters in this case. And because we're doing it in a stratified two-tiered way where it's going to appeal to individual donors and corporate donors, we have to recognize that not all donors behave similarly, and they're not going to be attracted to the same caps and percentages like tax credit incentive credits. And so for individuals, the research indicated that they responded more positively to programs that had lower caps combined with a higher credit. So for instance, in Arizona, they have a working poor tax credit that is set, it's capped at $400, but they get 100% tax credit on it. And then Endow Iowa is a program operating in Iowa that's geared towards corporations, and they operate with a $300,000 cap, but it's set with a 25% tax credit incentive. So we would design it based on that research, where we would combine a higher percentage with a lower cap for individuals and a more moderate tax incentive combined with a higher cap for corporations. And then so for distributional impacts, I'm going to speak more about this on the next slide when we look at challenges. The administration of this program would be pretty straightforward. Individuals and corporations would make donations to wellness funds, and then they would file their taxes and submit that information to the state, and then they would receive the credit. For accountability, we've written in extensively on this in our legislation, but we would have the wellness funds be certified through the state and the accountable communities for health as well. And the interventions would be state certified as well. So wellness funds would operate from, they would choose from a list of certified interventions that prove a high ROI population health initiatives. Donations to wellness funds operated by certified accountable communities for health. And so again, we want to instill as much accountability in here as we can. So the ACHs would be overseeing the wellness funds, and the state would be certifying the ACHs as well. And we also wrote in sunsetting the program similar to Nina's after 5 years, and we would ask them to submit reporting. So potential challenges. So unequal distribution across the state, as I mentioned on the previous slide. Some of the regions might be more civically minded or philanthropic than others. They might have wealthier individuals who are just like higher concentrations of wealthier individuals with higher income brackets in certain regions. So we would write in to the legislation that each wellness fund would remit some of their funds back to the state, which would be reallocated to less wealthy regions or less philanthropic regions so that there's more equity. Another challenge is that this is reliant on all these other infrastructures working. So the ACHs, the wellness funds, those have to be present, those have to exist, and they have to be working in alignment with the state government. And most importantly, this is reliant on donor behavior and the ability to market the value of a wellness fund to the average taxpayer, which is probably going to be difficult because the average taxpayer doesn't know what a wellness fund is. And then maintaining sustainability. So we actually thought how to design something that would encourage a sustainable backbone resource, which is what a wellness fund is supposed to be. And so we wrote in a graduated tax increase. So every year that a donor is continuously making a contribution, they would get a 3% increase on their tax credit. So it would start off at 50% for an individual, but if they donated the next year, they would get 53%. And so we're hoping to encourage that continuous donor behavior, and that would be available to individuals and corporations. So why charitable tax credits, and what would success look like? Okay, so states are already operating charitable tax credit programs right now that are targeted at anti-poverty or community foundations, and so why not health? And charitable giving is extremely popular right now, and it's only growing. If you look at what just happened in Puerto Rico with Hurricane Maria, a lot of the responses come from like wealthy individual private donors or crowdsourced philanthropy. And this pool is just expected to grow. The donor base is expected to grow. Millennials are set to inherit trillions of dollars in generational wealth over the next 3 to 4 decades. And the research has shown that they are interested in spending it on harm reduction and progressive causes and sectors like that. And they want to invest, and they want to see an ROI. So that's potentially an untapped market that could be appealing to a wellness fund if we can market the value of a wellness fund. And so what would success look like? Achieving better health outcomes, reducing healthcare costs, solidifying this sustainable backbone resource of a wellness fund, and then hopefully achieving improved equity through the design and the model of a wellness fund and ACH, and that they are intended to create local and inclusive control. So I'll pass it back over to Stacy.
Thank you. just going to summarize real quickly some key conclusions. Oh, yes, I do. Sorry. I was so eager to get up. Summarizing, tax credit programs are feasible. They might not be the easiest in the world, but they are feasible. We do really have to think about design. The effectiveness is contingent, and this goes for the tax policy we were hearing about this morning as well. There are opportunities for higher returns, and here's something I didn't say before that I want to say loud and clear. Good health is good economics. Health is economic development. All of these $45 billion in business incentives, go through some of the ROIs on some of these. You will see people, a lot of it is to, we were talking about this morning, higher, they improve people's ability to work, to earn. It is good economic development, and I think we have to keep that in our heads as we think about some of this. It's not just that, but it truly is that, and our own ReThink Health model shows huge advancements in productivity when you start to put together the right portfolios for population health. And as we talked about, we think, and as Pete had said this morning, and others, that the opportunities may really rest at the state level, a lot for the reasons that have been discussed. They've got this pot of funds that could be redeployed. States have to balance their budgets, so they're kind of interested in high ROI stuff. And I think that they're also becoming very aware, as some of the examples that Amanda gave, of what investing in healthier people can mean. So I promised a little comparison of taxes and tax credits. You will notice that I've divided this chart into two parts, much like the earlier panel was talking about. So there's the source of funds, where do the funds come from, and then how do we use them? So to start, how much is owed to the government? We've talked about this. With taxes, you're paying more. With tax credits, you're paying less. Participation, with taxes, it's mandatory. I pass a tax, you don't really get to decide whether you're going to pay that tax or not. With tax credits, it's voluntary. This is all about incentives. It's not surprising if you look at just those two, why tax credits and tax expenditures have been on this enormous rise and why they're bigger now than our discretionary spending in the United States. Because as politically, it's a lot easier to say I'm going to take less money and it's voluntary than to say I'm going to make you pay higher taxes. Design, very important in both cases. The word relatively is really important here. The distinction being that if you screw it up in tax credits, you've got no money. You've got nothing that really works at all. Whereas again, in taxes, it is more mandatory, so that at least you'd have something coming in. But there's absolutely no question about the need to attend to unintended consequences in both cases, as well as the other design implications that folks have been talking about throughout the day. So who's who's paying? In the case of taxes, it's government. You're taxing people, it's taxpayers. And this is who's paying for the interventions. In the case of tax credits, notice that the taxpayer becomes a co-investor, because we are tapping into the private market in this demand. So in Nina's case, the co-investor are self-insured employers. And in Amanda's case, the co-investors are people who want to make charitable contributions. So we're tapping into those private markets. Revenue predictability, fairly predictable on taxes. It depends on the tax. Really uncertain, can be very uncertain in tax credits, especially in the early stages as people learn more about it. And again, because it's an incentive, you don't know if you get it quite right or not. So down to the use of funds, who gets to decide how funds are used? As we talked about this morning, with taxes, it's really centralized. Usually the government is bringing those taxes in and pooling, and it's usually some function of government. It's more centralized how we're then going to spend those funds. In tax credits, it's really distributed more as individuals decide. Do I want to buy solar panels? Do I want to make a charitable contribution? Is it amenable to a portfolio approach? Now, this portfolio we've talked a little bit about, and again, our own ReThink model talks so much about how important that a portfolio makes, that it's not just about one kind of intervention. And taxes, yes, you could do a pool and then allocate it. It's a little more difficult in tax credits because you're stimulating markets. It tends to be about those individual purchases, right? Like for solar panels or not, but as we've shown, it is possible. The potential scope of interventions with taxes that can be funded is very broad. It's more narrow with tax credits in the sense that if the private investor is looking for an ROI, there might be things that aren't as amenable to fund through a tax credit. And then finally, the review process. Taxes, there's an annual budget setting. There is both on terms of they look at taxes. I used to be a budget director for San Francisco and in St. Paul, and ad nauseum sometimes, but very carefully budget setting process, as opposed to tax credits, which tend to go on the books and then they're kind of forgotten. They're known as off budget, and they just sit there, and unless and until they sunset, they can be very forgotten about. And so people keep claiming them, but there's no real review. What's interesting about that is the Pew Charitable Trust has recently been really looking into this and suggesting that states do a much better job of evaluating their state tax credits and incentives. And we've now got about 21 states that are saying, yes, we're going to start to evaluate. So there are these opportunities where people know that their tax expenditures or tax credits aren't really achieving what they could, and it really is our hope, and we hope we convinced you at least a little bit, that this might be an opportunity you will have an opportunity in a minute to keep our land use people from suffering and bring about health and well-being. So thank you very much.